Did you know that the month of May is Mental Health Awareness Month? Mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, and act, and helps determine how we handle stress, how we relate to others, and how we make choices. Mental health can impact your physical health too. It affects a great portion of your everyday life, but no one wants to talk about it, and it has been stigmatized. Mental health is something that affects everyone. It affects men and women, old and young, those physically healthy and those not. It doesn't matter who you are or where you come from because it affects everybody. Mental illnesses are disorders ranging from mild to severe that affect a person's thinking, mood, and/or behavior. According to the National Institute for Mental Health, nearly 1 in 5 adults live with mental illness. Many factors contribute to mental health conditions, including biological factors such as genes or brain chemistry, life experiences such as trauma or abuse, and family history of mental health problems. A serious mental illness, an SMI, is a mental illness that interferes with a person's life and ability to function. Despite common misconception, having an SMI is not a choice, a weakness, or a character flaw. It is not something that just passes or can be snapped out of with willpower. Mental illness does not just affect the individual, it affects loved ones, communities, and even economies. Having a mental health condition can make it a struggle to work, keep up with school, stick to a regular schedule, have healthy relationships, socialize, maintain hygiene, and more. However, with early and consistent treatment, often a combination of medication and psychotherapy, it is possible to manage these conditions, overcome challenges, and lead a meaningful and productive life. But asking for mental health support and gaining access to affordable resources may be two separate issues, as recent trends in mental health treatment suggest. Our country is facing an unprecedented mental health crisis. Millions of Americans experience symptoms of mental health conditions each year, and the number of people seeking care is trending upward. However, the crisis isn't just affecting adults, it's devastating young people, and people from every background are impacted. 42% of U.S. adults with a diagnosable condition reported in 2023 that they could not afford to access the treatment they needed, and 10% of youth covered by private insurance did not have access to mental health services in 2022. As of 2020, suicide is the second leading cause of death for children in the United States ages 10 to 14, preceded only by unintentional injury, and 25% of deaths in men ages 18 to 44 is caused by suicide. Destigmatizing mental health issues increases connection with others, helping communities support one another. Communities with more mental health resources help ease the strain on first responders and emergency services. 1 out of every 8 emergency room visits involve a mental health or substance abuse disorder. Mood disorders, such as depression and bipolar disorder, drive most hospitalizations for Americans under the age of 45. Adjusting for pregnancy and childbirth, among individuals experiencing housing insecurity, 20.8% have a serious mental health condition, and 70% of youth in juvenile detention centers have been diagnosed with a mental health disorder. The COVID-19 pandemic led to increased diagnoses of depression, anxiety, and suicidal ideation. Anxiety disorders such as generalized anxiety, obsessive-compulsive disorder, and panic disorder are some of the most commonly diagnosed mental health conditions in the United States, affecting 42.5 million adults. 21 million U.S. adults are living with depression, while 3.7 million people ages 12 to 17 are experiencing major depression. So what can we do to help? Two Rivers Public Health Department has named mental health and suicide prevention as one of our community health improvement priorities and largely focuses on awareness, education, and prevention activities. Additionally, TRPHD supports other local programs that provide treatment and foster social-emotional development. In celebration of Mental Health Awareness Month, we encourage the community to help destigmatize mental health conditions by using person-first language, such as saying, individuals with mental health conditions. We ask that people educate themselves on mental health disorders, and we ask that you take care of one another. Remember, be kind to each other, and together, we can achieve a healthier community for all.